After 6 years of study and exams, medical students around the country are today beginning to receive their first round offers for internships. But it's emerged that there aren't enough training positions available to meet what's a record number of graduates. This year, more than 3,500 students will graduate from medicine. That's an increase of more than 500 from last year. An article in today's Medical Journal of Australia says a new approach to medical training is required so that graduates can take the next step towards becoming a doctor. Monash University's Associate Professor Catherine Joyce says the solution could be to use facilities in the private sector and in regional areas. Well, for more on this, let's bring in James Churchill. He's the president of the Australian Medical Students Association, and he joins me now in the studio. James Churchill, thanks very much for coming in and talking to us.
No worries.
What is the nature of the problem from your point of view?
The issue we have at the moment is there's a shortfall of approximately 370 internships for the number of medical graduates of Australia's universities. So at the moment, it's looking like these internships may not exist for these graduates to move into and to continue their training in Australia.
Why is that?
So over a number of years, there's been deficiencies in workforce planning such that we may not be able to continue to train the medical graduates that Australian universities produce. That's a significant issue because there's a large amount of health system resources and valuable taxpayer dollars that go into training a medical graduate.
For a long time we heard about how there was a shortage of doctors, not enough doctors to service many areas of Australia. Universities increased positions available in courses to study medicine. This is the next consequence of the failure to plan.
Exactly. We've seen a doubling of the number of graduates since 2006, but the number of internships hasn't quite kept pace with that doubling. And so a medical graduate can't go on to practice in the Australian healthcare system without this internship. And so it's looking like we may be asking these graduates who've trained in the Australian healthcare system to move overseas or not to practice in medicine. It's ridiculous. At the same time as you've mentioned, significant workforce shortages in rural areas and significant problems with the health system.
Okay, you've just suggested that graduates might move overseas. I was going to ask you what's going to become of these graduates who are coming out of university with a medical degree but an inability to move to the next step of their career, their chosen career, as a doctor.
Well, certainly the problem is that they can't go through and continue their training in Australia without these internships. Now, the issue at the moment is being discussed at high levels of government, and there's a commitment that further quantification of the shortfall will happen, and that there will be a move to expand the numbers of internships. But we really need to see some urgency behind this action. And we also need to have state ministers held accountable to ensure that those increases do occur. We've certainly had assurances that the agreements that going forward, they've been assured that the places that at least some attention will be paid to this issue. But we need to ensure that these places are created, otherwise we'll lose these valuable graduates to overseas settings.
Professor John Dwyer was here in the last hour talking to us about this problem, and he was saying that really what this problem should do is become a catalyst for quite a radical rethink about the way we go about training our doctors.
Look, we do need to look at creative solutions to expand the capacity of our health system to accommodate these additional graduates that are coming through. And so we're certainly going to need to look at expansion into the private sector and also into other non-government sectors to essentially create the number of internships that we may need.
Okay, now what are you talking about there when you talk about expanding into the private sector, for example?
So the traditional model of intern teaching has sort of taken place in public hospitals, and we need to ensure that there's investigation of any capacity that we have to move into private settings and outside of major teaching hospitals, so that we're training students in the community and we're maximising the opportunities that we're training graduates, I should say, in the community.
But does an organisation like yours have concerns about the maintenance of quality, ensuring that graduates receive quality training before they essentially become a fully qualified doctor?
Absolutely. So certainly maintenance of quality has to be a critical concern in this whole process. If any new positions are created, we need to ensure that they are created with enough time such that they can go through the appropriate accreditation processes, and such that we can ensure that healthcare in Australia continues to be of the high standard that Australians expect.
What's likely to be the likely course for medical students who can't gain an internship? will they go overseas to try and get their qualifications, their experience, or are they likely to perhaps leave the medical profession?
Well, certainly there's a variety they're both certainly reasonable options, and it may be that medical graduates are forced to go overseas or not to practice medicine, which would be a massive waste of, as I said, of valuable health system resources and taxpayer dollars if these students aren't able to continue in Australia. Latest government reports indicate that we need all of the graduates that Australia is producing, that we are currently facing a workforce shortage going into the future. And so it's ridiculous to be training graduates of Australian medical schools and not allowing them to continue their training in Australia.
Is the problem here that state governments have skimped too much on their health budgets, and as a result of that there aren't the opportunities for medical students to gain internships because there aren't enough hospitals staffed by enough qualified doctors in order to give them the training experience?
So certainly over the recent years there has been an increase in the number of internships available, but as I mentioned, that's not quite kept pace with the growth in graduates that's been introduced by the federal government. We've got an issue of there being insufficient coordination between the different arms of the system, such that the federal government increases the number of Commonwealth supported places, the universities can create the number of international student and full fee places that they wish, and the state governments are left holding the baby, having to fund the positions that are needed to allow these students and these graduates to continue their training.
Okay, James Churchill, thanks for coming in and explaining that for us here at Afternoon Live.
Thank you.